Hello, I'm Dr. Britton, DC, with West LA Functional Neurology, Neurokinesiology, and Neuropathy. And today I'm with Lynette, and we're going to go over some of our reviews so that way when we talk to patients, we make sure that we interview them, make sure that we're moving along at a pace that's acceptable and that they're feeling improvement. And Lynette's been so nice to just sort of talk to us about your story because it's unique. You're not somebody who never saw a doctor in their whole life or never had a chance to be able to get any medical care ever or health care before. So just tell me, for you, when you end up seeing our ad and seeing some of the things, what came up for you that made you decide to come in? What were some of your worries and some of your hopes?
My thing was I've tried so many doctors, chiropractors, acupuncture, physical therapists. I've been there, done it all, spent numerous amounts of money. So I said I've got nothing to lose and notice again, it's just money.
Yeah.
So I came in the office, first 2 girls are great. That was a big thing for me.
Okay.
The atmosphere, and I met you, and the way you spoke was, I don't care how much you were charging, I was coming because you spoke like, you touched me right here, you went right down to here, and I kind of had an electric shock. It was like, whoa, that pain. So you did stuff that I've never had done before, and the way you spoke like you just knew so much more than I've had from other doctors. So that's why I'm here.
Excellent, thank you. And I'm really glad for the trust. I also want to ask you, for you, when you look at what you had they given you other diagnoses? Had someone diagnosed you and told you have X, Y, or Z?
No, I was told I have all this stuff moving about. The doctor said, don't know what it is. I've been to back specialist, and he said, to tell you the truth, I don't know what's wrong with your back. So, and I did actually go to one physical therapist, and he told me I've got very weak butt muscles because I don't really work my butt muscles because my knees hurt, my back hurts, so I don't kind of get a chance to really work them that much.
Okay. So
that was the only kind of sense that I had. Acupuncture, chiropractor, I've done it all, been there. I was getting the same adjustments for years, and I was like, well, this can't be right. You have not reevaluated me, but you're doing the same, crack, crack, crack. And I was fine for a couple of hours, I'd leave fine. A couple of hours after that, back to square one. After getting a few treatments with you, I was like, I realize when I'm in pain, but I don't realize when I'm not in pain. Okay. And then I think about it, I'm like, whoa, I'm not in pain, I haven't been in pain. I went to England for a week, and I wasn't in pain for a whole week. So.
And how long have you been fighting this battle?
22 years.
In the United States, outside of the United States?
Just here, just here, because I think I did injure myself, snowboarding maybe. I've got bad posture, but I've been in chronic pain 6 and up for 20 odd years. So wow. I've just learned to deal with it. It's part of my life.
Now, she's still in the program, so I don't want to say we've cured something or anything like that. But I just want to know, like, when you came in, how many days a week or maybe a month did you have 8, 9, or 10 out of 10 pain?
Oh, I'd say probably 4 days a week.
4 days a week. Yeah. And coming up these last 2 weeks, we'll take a whole last 2 weeks. How many days would you say that you're finding that you're in 8 out of 10 pain or above?
I haven't. I've been in for the last 2 weeks. I've been in a 3.
Okay. And
I've never ever been there.
And so she's just at a point where we're going to start actually creating a workout protocol for her. So this is just working in the office, and then obviously she's active. She's a snowboarder. She's a very active person on her own.
No more snowboarding. I did it once.
No more snowboarding. Oh, okay.
No,
right. And so if there's anything you want to say to people who've seen it all, tried everybody, been every place, the reasonable people over 30 who have just been failed so many times, what is it that you would say to have them, think about what your experience is?
I would only say just give it a try. I mean, there's so many people do different things, but what I get here, I walked in, I saw these tables. For me, decompression is a big thing. I feel so much better than the little electrodes you put on me, the laser, and then your adjustments are different. I've never had an adjustment like that, and I've been to see a lot of chiropractors, and your adjustments are very different. And I know it's a lot of body work for you because you're pulling me up and doing crazy stuff.